Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, this is Dr. Kian Karimi. I'm the primary author of the study titled Effectiveness of an Autologous Filler in Patients with Moderate to Severe Nasolabial Folds, a pilot study. So this study really came about from my work with platelet-rich fibrin and albumin-rich fibrin. I've been part of the kind of investigational group looking at platelet-rich fibrin, not only for surgical aspects like in rhinoplasty, fat transfer, facelift, etc., but also in the non-surgical realm. In 2016, when platelet-rich fibrin was first kind of utilized in the United States, a lot of patients were excited about it as an autologous filler, so to speak. This was really before this kind of current backlash we've seen about fillers and hyaluronic acid fillers for various different reasons. And I found then, anecdotally, that when I injected just platelet-rich fibrin as a standalone, it would last maybe 4 to 6 weeks. And so patients were looking for something that was a little bit longer lasting. And in kind of scouring the oral and maxillofacial and dental literature, which is really where a lot of platelet science comes from, I came across albumin-rich platelet-rich fibrin, which is essentially the portion of the platelet-rich fibrin, PRF, heated to start to unfold the albumin, therefore quadrupling its surface area and acting as a scaffolding for a longer-lasting result, so to speak. So anecdotally, again, we were seeing that it was lasting longer than just PRF, so we decided to study it using objective measures and also to look at safety, efficacy, and duration. The question I really wanted to answer was, is albumin-rich PRF safe? The second question was, what is the duration of albumin-rich fibrin, and what are kind of best practices or protocols to offer these to patients? And lastly, I wanted to know, are patients happy? Are they satisfied with this treatment? We did actually answer all of these different questions, and I can kind of review some of the high points. You can obviously read the paper for the more specifics of this, but essentially we did find that the duration of the albumin-rich platelet-rich fibrin was better than we expected. We saw durations of several months from the treatment, and we even saw when we concluded the study at week 24, we still saw some volumization that we measured with 3D volumetric photography. As we expected, because it is 100% autologous, the procedure was very safe. We only had one adverse event, a real treatment-related adverse event, I should say, in the study, and that was related to a patient who contracted COVID right around the time that they received the injection. So they reported prolonged edema, which did actually go away after 2 weeks. But there were no incidences of infections, vascular adverse events, or any other untoward events from the treatments. Lastly, the patient satisfaction was quite high. We found that the vast majority of patients, I believe it was around 92 or 93%, were either reported improvement or significant improvement of their baseline from the assessing their nasolabial folds. So in summary, we really found that this is a good first step in terms of studying platelet science, particularly platelet-rich fibrin and albumin-rich fibrin. We really wanted to kind of keep things autologous. There are other systems out there. There are other, products out there that combine autologous materials with non-autologous materials. But I think that the real trend now and the real push, although we hear the word biostimulators a lot, the biostimulators are synthetic. They may be powdered suture materials, they may be bone gels, they may be other things, but they're still a synthetic material. So short of fat transfer, which really can only be done by surgeons in the non-surgical space, which is a vast majority of the aesthetics here in the United States, continuing to study platelet-rich fibrin, albumin, platelet-rich fibrin, or other ways that we can utilize our own blood and blood products for biostimulation, volumization, and skin improvement, I think really is the future. Thank you so much for listening to this and for your attention and for your interest in autologous blood platelet products. I think you have my correspondence in the paper, but my email address is kiankarimi@gmail.com, and my Instagram is @Dr. Kian. I want to thank my co-authors who were really helpful in terms of acquiring the data, getting the patients in for their scheduled visits, and all the things that those of you that have been involved with any sort of clinical trials know how painstaking that can be. Thank you very much, and I hope you all having a great day.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.